Childbirth is a deeply significant human event. For centuries, birth primarily occurred at home. Women were often supported by other women. Traditions and experience guided these births. Medical interventions were not common. The focus was on natural processes. This history sets a baseline for our understanding. It shows birth as a community-supported experience. We see roots of today's discussions here. The past informs our modern questions. Medical science then began to change childbirth. Hospitals became commonplaces for delivery. Doctors introduced new tools and techniques. This offered new ways to manage risks. Pain relief options also became available. This shift brought many benefits. It also created new types of decisions. Women started to have more defined choices. The birth landscape was forever altered. These changes were quite profound. This brings us to a persistent debate: natural vaginal birth versus cesarean section. Why does this topic still spark so much discussion? It touches on deeply personal feelings. It involves medical facts and societal views. Everyone wants the best outcome for mother and baby. The definition of best can vary widely. This debate is not new. It reflects evolving values and knowledge. Understanding this debate requires looking at all sides. There isn't one single answer for everyone. This essay will explore both vaginal birth and C-sections. We will look at their benefits and risks. We will consider different perspectives. Mothers, doctors, and midwives all have insights. The goal is informed choice, not a simple verdict. This complex decision deserves careful thought. Vaginal birth is often called natural birth. It means the baby is born through the birth canal. This process is driven by the mother's body. Hormones play a crucial role in starting labor. Labor progresses through several distinct stages. The body naturally works to deliver the baby. Many see this as the physiological standard. It is how humans have typically given birth. This method has been studied extensively. Many believe vaginal birth has key benefits for the mother. Recovery can often be quicker than surgical recovery. There is usually less postpartum pain. The risk of complications from major surgery is avoided. Some mothers report feeling empowered by the experience. Immediate skin-to-skin contact is often easier. This can help with early bonding. These are important considerations for many. They value the physical and emotional aspects. Babies may also gain benefits from vaginal birth. During birth, babies are exposed to beneficial bacteria. This happens in the mother's birth canal. This exposure might help build their microbiome. It could support their immune system development. The process of passing through the canal helps clear fluid from their lungs. This can aid their first breaths. These potential benefits are often highlighted. Research continues to explore these areas. Midwives often champion vaginal birth. They view it as a normal, healthy process. They support women through labor with this philosophy. Many mothers share this preference. They aim for an unmedicated, intervention-free experience if possible. Doctors also support vaginal birth. They recommend it when it is safe for both mother and baby. It is generally the first option considered. The emphasis is on a safe, positive outcome. A cesarean section, or C-section, is a surgical procedure. The baby is delivered through an incision. This incision is made in the mother's abdomen and uterus. It is a major abdominal surgery. C-sections can be planned in advance. They can also be performed in an emergency. This happens if unexpected problems arise during labor. Skilled obstetricians perform this complex operation. It requires a sterile hospital environment. C-sections are medically necessary in many situations. They can be life-saving for the mother or baby. Conditions like placenta previa make vaginal birth dangerous. If the baby is in a breech position, a C-section might be safer. Fetal distress during labor is another key reason. A C-section can prevent birth injuries in such cases. It can also avoid a very long, difficult labor. Doctors weigh these factors carefully. The primary goal is always safety. Planned C-sections also offer certain advantages. They provide predictability in timing. The birth date is scheduled in advance. This can reduce anxiety for some expectant parents. It avoids the uncertainties of when labor will start. Some women choose a planned C-section for personal reasons. This might relate to previous birth experiences, or it could be due to specific fears about vaginal birth. Patient autonomy is increasingly recognized here. Doctors see C-sections as an essential medical tool. It allows them to manage high-risk situations effectively. Many mothers feel immense gratitude for their C-sections. they recognize it ensured their or their baby's well-being. However, if a C-section was unplanned, some mothers might feel disappointed. They may need time to process the change in their birth plan. The rising rates of C-sections globally are also a topic of ongoing discussion among health professionals. Data on health risks and benefits is important. Vaginal birth has some risks. These include perineal tearing or pelvic floor issues later. C-sections carry risks of any major surgery. These include infection, blood clots, or longer recovery. Future pregnancies might also be affected by a C-section. In places with good medical care, serious risks for either method are low. However, individual risk factors vary. Discussing these with a doctor is key. Emotional and psychological factors are also significant. The birth experience has a lasting impact. Some women feel a great sense of accomplishment from vaginal birth. Others feel equally positive about their C-section, planned or emergency. Negative feelings can arise too. This might be disappointment or trauma if the birth did not go as hoped. Postpartum mood can be influenced by the birth experience. Supporting all mothers, regardless of birth type, is vital. Every birth story is valid. Societal pressures can influence choices. There is often a narrative that natural is best. This can make some women feel pressured. They might feel they need to aim for a specific type of birth, but personal preferences and circumstances matter greatly. A woman's medical history is important. Her fears or anxieties are also valid considerations. True informed choice means weighing all these elements. Autonomy and decision-making is crucial. The debate between natural birth and C-sections continues. It continues because there is no single right answer. What is best depends on the individual. It involves her health, her baby's health, and her values. Medical advice from doctors and midwives is essential. Personal research helps too. Ultimately, the goal is a healthy mother and a healthy baby. Modern medicine offers more choices than ever before. This allows for more personalized birth plans.